By March this year, there were warning signs of a COVID-19 second wave in India. But Tamil Nadu, like three other poll-bound states, saw hectic campaigning for assembly elections, culminating in single-phase polling on April 6th. Throughout this period, states across the country were going under curfews and lockdowns one after another. In Tamil Nadu, however, a caretaker government held forth, unable to take a similar decision in a poll-bound state. In the period from April 15th to May 15th, COVID positive cases soared from 58,000 to over 2 lakh. Despite the lack of a functioning government at this crucial juncture, how did Tamil Nadu deal with the second wave? Let's find out. By late last year, life had returned almost to normal in many parts of Tamil Nadu. In February 2021, just over 13,000 positive cases were reported, the lowest since the start of the pandemic. By the end of the month, with the announcement of assembly elections, the state went into campaign mode. The lack of COVID-appropriate behaviour and election rallies, while cases were on the rise, led the High Court to hear a suo motu PIL on April 22nd regarding COVID-19 preparedness. The High Court took stock of the situation and asked the Health Secretary to give a status report on oxygen supply, stock of drugs, and even asked why more restrictions cannot be imposed in the state. The difficult decision of lockdown was left to be taken by the new government, which would not be formed for at least the next 10 days. In the meantime, the caretaker Chief Minister Swami did take review meetings but refrained from announcing any strict measures like the lockdown, which the neighbouring states were already under. By the time the results were announced on May 2nd, crucial time was lost. Unlike other states where the election verdict was for continuity, TN saw a new government in power after a decade.
முத்துவேல் கருணாநிதி ஸ்டாலின் என்னும் நான்
After the new DMK-led government took over on May 7th, the new Chief Minister, M.K. Stalin, reluctantly announced a lockdown from May 10 to May 24. By the time the lockdown was imposed on May 10, the number of COVID cases in the state had grown by 300%.
This lockdown, after the virus spreads very widely, have only a limited value. So what is useful now, showrooms, departmental stores, where the closed and contained space where the cluster of transmission occurs. So that had been completely cut off now, the lockdown. That is the biggest effect of this lockdown, current lockdown.
Meanwhile, despite the rise in cases and the shift in power, the health infrastructure built over the years and augmented after the first wave had managed to hold on.
The dedicated public health cadre and the infrastructure, huge infrastructure developed under the Tamil Nadu health over the last 2-3 decades is not an one-day development. The infrastructure, every district, the aim of the government to establish every district one medical college. It means improvement in availability of HR, availability of infrastructure, availability of the system to handle. So the first wave came, the system is able to handle very well. During the last 1 year, consciously the government has increased the number of oxygen beds and also the oxygen storage capacity. Many medical colleges are now having 40 kiloliters. 40 kiloliters means 40,000 liters of oxygen. The government had, the last 1 year, had increased the capacity to more than 10 times the government healthcare facilities. So that is coming in a big way in helping the system to withstand this kind of a pandemic.
The state seems to have arrested a surge in COVID cases by employing effective triaging methods both in urban and rural centers, often prioritizing hospitalization of symptomatic patients with respiratory issues even before they test positive for COVID-19. This has reduced the dependence on medical oxygen in the state in the initial days. The oxygen allocation, which was 220 MT in April, is around 520 MT, and additional oxygen has been received from the center. The treatment protocol for COVID-19 in the state is also more in tune with the latest research regarding the prescription of drugs. The new government dropped plasma therapy from the treatment protocol days before ICMR dropped it from theirs. Other drugs such as ivermectin, hydroxychloroquine and remdesivir have also been dropped from the official protocol, leaving the usage to the practitioner's discretion. The situation is quite grim but far from the scenes of helplessness seen in other states. Long queues of ambulance vans outside government-run COVID hospitals are growing each hour. ICU beds are fast filling up.
And one more, the serious issue is private sector. The private sector has not increased the proportionate as done by the government. So there are many private medical colleges, there are many corporate hospitals which are having 500 beds, even 1000 beds. Such hospitals should have done more. They should have created their infrastructure better. It's really difficult to understand why this has not happened. So many of these hospitals are looking at the government. They're simply calling 104 and can you give us, send us 5 KL liquid oxygen? Can you send us 25 cylinders? So this is not the fair way that the private establishments are acting. So now the government hospitals have to bear the load of the cases referred from the transferred from the private hospitals also. So this is causing additional burden on the government healthcare facilities.
Despite a late lockdown, the public health infrastructure appears to be tackling the second wave better than other Indian states. Reporting of death figures has also increased, though actual numbers might be much higher. With its public health infrastructure in place, Tamil Nadu can perhaps focus on preparing for the third wave and shore up infrastructure in areas where the incidence of COVID cases has been relatively low so far.